pay for the care that his son needed, something he believed every American deserved. A few weeks later, as efforts to repeal Obamacare were gaining steam, Senator Bill Cassidy explained that the bar that he believed that any health care bill had to clear to get his vote was what he called the Kimmel Test. He said, quote, "Will a child born with congenital heart disease be able to get everything she or he would need in the first year of life?" When Kimmel interviewed Senator Cassidy a few days later, Kimmel explained the test this way, quote, "No family should be denied medical care, emergency or otherwise, because they can't afford it." Well, I'm here to report that this latest version of Trumpcare, offered by none other than Senator Cassidy himself, fails the Kimmel Test miserably. Over the past few weeks, there have been two ongoing conversations about the future of health care in the United States. The first has been conducted in an open, bipartisan manner in the Senate Health, Education, Labor, and Pensions Committee, in full accord with the traditions of this body. In the Health Committee, Republicans and Democrats alike have been talking with governors, insurance commissioners, and other experts on ways to address concerns of states and consumers by stabilizing the individual market and lowering premium costs. That's how the Senate is supposed to work. And the bill that emerges from that process will be one that makes things better, not worse. It will create certainty. It will bring down costs for consumers. It's a bill that any senator should be proud to vote for. The second conversation is a model of how things shouldn't work. It has occurred behind closed doors between Senate Republicans and party operatives. It's not about making the system work. It's about passing something, anything, that can be said to repeal and replace the Affordable Care Act, and along the way, it destroys the Medicaid program as we know it. As many of us have argued before, this conversation is an affront to the traditions of this body and, more importantly, to the will of the American people. I urge my Republican colleagues to oppose the Graham-Cassidy bill, the newest iteration of Trumpcare, which will rip health care coverage from tens of millions of people, create higher costs for consumers, and ensure the destabilization of the individual health insurance market. While I have worked closely with Senators Cassidy and Graham on other bills, and I respect them, I have grave concerns with this legislation. First, the bill undermines protections for people with pre-existing conditions. States could apply for waivers that would allow them to charge people more based on their health status, age, or any other factor other than race or ethnicity. This means premiums would be higher just for being older or sicker or having had an illness in the past. In other words, there would be no protection for people with pre-existing conditions. Additionally, states can also seek waivers to remove the ACA's essential health benefit requirements, which mandate that insurers offer plans on exchanges that are offering plans on the exchanges include coverage for vital services like prescription drugs, maternity care, and mental health and substance disorder services. While the bill technically requires states to describe, just simply describe, how they will, quote, maintain access to adequate and affordable health care for individuals with pre-existing conditions, end quote, there's no definition of what that means, and there are no enforcement mechanisms. Insurers would still be able to charge people with pre-existing conditions more for their care or exclude services altogether. Under this plan, millions of people with pre-existing conditions could face much, much higher costs if they can get coverage at all. Again, this bill rips away protections for people with pre-existing conditions. Second, the bill would undoubtedly reverse the significant coverage gains we've seen in recent years and drive up the number of Americans without health insurance. The Graham-Cassidy proposal eliminates the ACA's premium subsidies, eliminates the Medicaid expansion, eliminates cost-sharing reduction payments, and more. Instead of funding these critical aspects of the ACA, the bill would return some, but not all, of this funding to the states in the form of block grants, which are authorized in this bill from 2020 to 2026. The bill also proposes to dramatically reduce funds for states that have expanded Medicaid and have successfully enrolled more adults in ACA exchanges, states like Minnesota. Instead of incentivizing success, the bill will reward failure, initially increasing funds for states that refuse to expand Medicaid and have done little to encourage enrollment. But even these states lose out in the end. In fact, the funding stops completely after 2026, resulting in enormous losses for every state. And even prior to 2026, the Center on Budget and Policy Priorities estimates that most states will receive significantly less funding from the federal government under this block grant than they do under current law. Minnesota could lose $2.7 billion. And other senators who have expressed various levels of concern with this legislation could see their states lose significant sums. Those include Arizona, which would lose $1.6 billion. Alaska, $255 million. Maine, $115 million. Colorado, $823 million. The list goes on. Healthcare isn't free. These shortfalls will mean the families don't get the services they need. On top of all that, the Graham-Cassidy proposal caps and cuts Medicaid, a program that provides coverage to seniors, families with children, and people with disabilities. In Minnesota alone, that's 1.2 million people facing cuts to their benefits or losing coverage altogether. I believe many of us truly want to help our constituents access the care they need. As I said before, the ACA is far from perfect, but it has resulted in significant improvements in millions of people's lives. I have heard from countless Minnesotans who have literally had their life or the life of a loved one saved by the ACA. The same way that Billy Kimmel's life was saved by the treatment that he was able to receive at the beginning of his life. Take Leanna, for example. Leanna's 3-year-old son, Henry, has been diagnosed with acute lymphoblastic leukemia. His treatment will last until at least April of 2018. He often needs around-the-clock care to manage his nausea, vomiting, pain, and sleepless nights, a 3-year-old. Henry's immune system is so compromised that he's not supposed to go to daycare, so Leanna left her job to care for him. Leanna and Henry are supported by her spouse, but they couldn't pay for Henry's treatment on one salary. Leanna says, and I quote, "It is because of the ACA that Henry gets proper health care. Henry can get therapy and the things he needs to maintain his health and work towards beating cancer. Henry is still with us because of the ACA." End quote. Let me say that again. 3-year-old Henry is still with us because of the ACA. Or consider Maria's story. Maria enrolled in Minnesota's Medicaid program after finishing her graduate degree and while looking for full-time employment. Maria was grateful for the coverage because she needed access to treatments for her endometriosis, which was diagnosed a few years prior while she had insurance through her employer. Soon, Maria found her dream job, but it came with a catch: no health insurance. Days before she was set to move and start work, she decided to go in for one last big checkup. The results were unnerving. At the age of 35, Maria was diagnosed with bilateral breast cancer. Maria had to give up her job offer and aggressively pursue treatment for the cancer. Fortunately, because Minnesota had expanded Medicaid, all of Maria's treatments were covered, and lucky for her, they worked. Maria's cancer is in remission. Maria explains that, quote, "The Medicaid expansion of the ACA literally saved my life," end quote. She told me that anyone could find themselves on Medicaid, and I quote, "Without that comprehensive, affordable, accessible health insurance, I wouldn't be here." But now that all of these programs are in jeopardy, my constituents are genuinely scared. They come to me in tears, explaining that if the Affordable Care Act is repealed or draconian changes and cuts to Medicaid go through, they don't know how they will care for their elderly parents, keep their rural hospital open, or afford treatments that they or their children need. I believe it is legislative malpractice to pass partisan legislation that would undermine this progress, people's economic security, and their livelihood, all to achieve a destructive political end. To do it without holding thorough hearings in the committees of jurisdiction, without hearing from experts, and without a complete assessment from the Congressional Budget Office on how this legislation would affect the American people. I urge my Republican colleagues to once again abandon their efforts to ram through dangerous legislation that would fundamentally restructure our health care system. This new iteration of Trumpcare fails the Jimmy Kimmel Test. It's the result of a horrible process that is not worthy of this body. We have a better option. Over the past few weeks, Chairman Alexander and Ranking Member Murray have held 4 bipartisan hearings on individual health insurance market reforms that are working to forge a legislative compromise to reduce premiums for consumers. We've heard from governors, we've heard from insurance commissioners, and we've heard from experts, all of whom span the ideological spectrum. This is what regular order looks like. And this is the way the Senate is supposed to work. I've worked with all of my colleagues on this committee in good faith, and I am proud of what we've been able to accomplish so far. But all of that work is in jeopardy because of a destructive, partisan, last-ditch effort to repeal the Affordable Care Act and end the Medicaid program as we know it. Do not shortchange those important legislative developments, and do not shortchange the American people. Think of the millions of children and families that need our help right now. Oppose Obamacare. And instead, let's work to improve care, to lower costs, and to ensure access to health care when people need it the most. It is within our reach.